Hello everyone. In this class, we'll try to learn about different aspects of arterial pulse. Aim here is to examine the radial arterial pulse. And if you see, the definition of pulse is defined as a rhythmic expansion of arterial wall due to the transmission of pressure waves along the arteries produced during each ventricular systole of heart. The different sites where the arterial pulse can be felt is superficial temporal, carotid, brachial, radial, femoral artery, popliteal artery, posterior tibial artery, dorsalis pedis. The method of examination, they can be clinical and instrumental, and instrumental is mainly done by Duchen's sphygmograph. The clinical method is where the forearm is semi-pronated and wrist is slightly flexed and palpation is done with 3 fingers. The purpose of different fingers are: the middle finger is to feel the pulse, the proximal finger is used for applying pressure on the artery, and the distal finger prevents the retrograde blood flow from the deep palmar arch. And then the count of the pulse is done for 1 minute. So this is how the pulse examination is done using the 3 fingers, the index finger, middle finger, and the ring finger, where the index finger is utilized for the occluding the vessels, and the ring finger is used for emptying the vessels, and middle finger is utilized for feeling of the pulse. Different observation are done when the radial pulse is palpated. So they can be rhythm, rate, volume, force, tension, condition of the vessel wall, character of the vessel wall, and equality of the volume on the both the side of arterial pulse is determined. Rate, it is the number of beats per minute. The normal heart rate in adults is around 60 to 90 beats per minute. So tachycardia is when the heart rate or pulse rate increases more than 90 beats per minute, and bradycardia means decrease in the pulse rate, that is when it falls less than 60 beats per minute. And pulse deficit, so which is nothing but the difference between the heart rate and the pulse rate. So heart rate is auscultated at the mitral area, whereas the pulse rate, it is observed at the radial pulse. So the difference between the heart rate and pulse rate is called as pulse deficit. Rhythm may be regular, or it is also called as sinus rhythm, regularly irregular, or sinus arrhythmia, or irregularly irregular. Then volume of the pulse is measured as a degree of uplift felt by the finger. So it is going to signify the stroke volume, and it indicates pulse pressure. That is the difference between the systolic and the diastolic blood pressure. Then character of the vessel wall, it is the slope of the pulse wave, the rate at which the finger is lifted up and down. So normally ascent and descents are smooth and gradual in a normal pulse. The pulse with abnormal character is seen in fever and thyrotoxicosis. Okay. So this is how the pulse is felt. When it is recorded with the instrument, you can see the different waves: the tidal wave, the diacrotic notch, and the anacrotic notch. Okay. So this is anacrotic notch, this is the tidal wave, so this is the diacrotic notch, and so this is called as percussion wave. Okay. So these things happen in systole, and these are the phases after diacrotic notch. It is a diastole. Different pulse rhythm which are observed are regular at regular interval. Then it can be regular at irregular at regular intervals, and then it can be irregularly Irregularity is repeated irregularly at irregular interval. And different types of the pulse, you can see here the normal water hammer pulse, okay, so which is sudden upstroke and downstroke, so which are seen in aortic regurgitation. Slow rising pulse is commonly seen in aortic stenosis. Pulses bisferens, you can see the double pulsation, so which can be seen in severe heart diseases like uh, the hypertrophic obstructive cardiomyopathy or with aortic regurgitation. And pulses alternance, I mean alternative strong and weak pulses are seen, so which are seen mainly in case of ventricular dysfunction. Okay. So similarly, arterial pulse trace can be like this in normal. So when there is a small and weak pulses, the arterial tracing seems to be like this. And in large bounding pulses, like in hyperdynamic circulation, fever or thyrotoxicosis, it is seen like this. And in bisferens pulses, the tracing looks like this, and pulses alternates, so you can see the double wave at the height of contraction. Anacrotic pulse is characterized by a pulse which is very slow to rise and occurs in aortic stenosis, where you can see prolonged ejection of stroke volume due to the obstruction at the aortic orifice. Diacritic pulse is nothing but two waves are felt during each heartbeat. That is, the second wave is being smaller than the first. The diacritic pulse is seen usually in typhoid fever and dehydration. Collapsing pulse is where both the upstroke and downstroke are very steep and the amplitude of the wave is greater, and hence the lift and fall of the finger is sudden and greater. So this can occur usually in aortic regurgitation. Then condition of the vessel wall. Sufficient pressure should be exerted to empty the vessel, and it should be rolled beneath the other fingers against the bone. Normally it is not felt. In older person it is easily palpable. It is felt like a cord due to the atherosclerotic or calcific changes. Then in the end, equality. Palpate the radial pulse on both the sides simultaneously to compare the volume of each pulse. Then, as we said, other pulsatile arteries of the body are superficial temporal artery, carotid artery, femoral artery, and dorsalis pedis artery, which are more commonly palpate. Then in the end, the report should be written, and the rate, the rhythm, volume, force, tension, character, and condition of the vessel wall and equality of the pulse wave should be mentioned in the report. So that is in brief about how you examine the arterial pulse. Thanks for watching.